Hello and welcome to the EduTalk series hosted by Biotone Edu Partner Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Irene Diamond, founder of the first international fitness cruise company in 1987 and San Francisco's premier wellness center in 1995. She's author of Design Your Dream Practice, introducing precise private practice as the go-to model to serve clients, gain provider referrals, and inspire clinic owners to maximize revenues. Her activated diamond includes the diamond method, rehab approach for fibromyalgia, migraine, and orthopedic pain, and the diamond active massage benefiting luxury spas and private practices. Let's listen and learn as Irene shares tips for clients who demand a damn great massage. She'll reveal how you can deliver extraordinary relief with ease and command higher fees by offering a diamond active massage. The new massage approach is the opposite of traditional massage. In aDAM, clients actively engage their muscles while receiving manual soft tissue glides, producing faster, comprehensive, long-lasting relief. Understand easily how incorporating clients' active movement while you massage them is a win-win for you both. We have a lot to get to. Irene, thank you for joining us again. Irene has been a past presenter of EduTalk, so please visit the EduTalk Archive Library on biotone.com to see her other talks. And with that, feel free to chat questions, which Irene will answer at the end. And I'll exit the screen. I'll see you on the other side, and we'll answer the chats. Here you go.
Thanks, Donnell. Hi, everybody. Welcome. I'm excited to have you be here to hopefully blow your mind a little bit. That's always my goal. And I always say together we are even more brilliant. So I'm coming to you with 30 years of experience, practice knowledge, business growth under my belt. And I hope I can share some shortcuts and some inspiration for you today. So without further ado, I am going to share my screen. And actually, no, before I do that, I like to use the chat. I want you to be interactive. My background is as a movement-based rehab therapist. So movement, kinetic, gets into our brains more, which is why I'm all about active client involvement. But for you as an audience here in this presentation, we're going to use the chat. So right now, please, in the chat, go ahead and type in what one thing you'd like to learn. If you know, when you came to this presentation, when you signed up, what was the one thing you wanted to learn? Let me see in the chat, and we'll use that to jump to as our jumping off point. So use the chat here. What is the one thing about giving a damn good massage that you would like to learn? Don't be shy. Don't be shy. What would you like to learn? What is the one thing? And my question then, if you don't have one thing, would you like to learn how to give the best damn massage in town? David says an easier way to relax muscles. This is it. Anybody else? Thank you, David, for that. If you'd like to give the best damn massage in your town, please pop a comment in there and say yes. Kirsten says, more techniques for interacting with the nervous system. Absolutely. Donnell says, are clients open to non-traditional approach? Perfect question. Anybody else? Pop in the comments if you're looking how to be the best damn massage therapist in your town. Now I say that a lot of people, when I mentioned the name Diamond Active Massage, and I said, you know, we're going to call it like, you're going to give the best damn massage. They're like, oh, you can't say that. I said, yes, we can, and we will. And it'll help you stand out by being a little, I don't know, is that kosher to say? Stephanie says, how to incorporate new client engagement techniques into what I'm already doing. This can absolutely be integrated into what you're already doing. So thank you for those comments. I love that. All right, I am going to share my screen. So here we go. Perfect. Okay, I believe you can see my screen. So this again, providing the best damn massage in town. This is an introduction to Diamond Active Massage. So obviously, I can't teach you everything, but I am going to pack as much as I possibly can into today's session. And if you want more, I would love to have you reach out to me after the presentation and we can talk about getting you trained or bringing it to your practice, spa, gym, or clinic. So a little more about me. There's 30 years, like I mentioned, of being an activated diamond. That's my business acceleration brand. And it's an umbrella for the clinical components I teach, which is now Diamond Active Massage, as well as active modulation therapy. I also have the business aspect. So Give to Get Gold, We Give Back Marketing is the only marketing campaign you'll ever need. And it's free, doesn't require ads or anything like that. One per city, per profession is available. So reach out to me if you're looking for marketing in an ethical, graceful, responsible, respectable manner. I also will help you with my ethical fee increase program, how to raise your fees. And then I have coaching and of course my brand new book, Design Your Dream Practice. So hopefully what I have to say will resonate with you today. Now we all love massage. When I started my practice in San Francisco, it was called Diamond Massage and Wellness. Massage is for all of us here. We're true believers in it. I don't need to convince you, but let's be honest. There's some things that being a massage therapist or running a massage business provides challenge. What challenges have you found about being a massage therapist? And do you agree? Use the chat. Do you agree that there are some challenges from having a massage business? If you agree, go ahead and put that in the chat. If I asked you right now to state the number one thing you dislike or that you want to change about practicing massage, write it down in the chat. And this is funny because I wrote write it down, and then when I reviewed my notes, I spelled right incorrectly. I spelled right wrong. So I will fix this in the handouts that I get you. But what would you say are some of the challenges? Write them down in the chat, because I know what challenges I faced when I started my massage practice. I know what challenges my coaching clients who are practice owners face. And I'd love to see what you have to say. I'm going to stop my screen share for a moment so I can jump into the chat. What are the challenges that you personally face from running a massage business? Because this is going to help us strategize about how Diamond Active Massage can benefit you by removing those challenges. Anybody want to add anything in here? While you're doing that, I'm going to go back to share my screen. Okay, so maybe some of you would say it's physically hard on your body. If you agree, nod your head. Some of you say it's physically challenging to find clients. Nod your head if you agree. You might say clients don't want to pay very much, or there's lots of competition, or your schedule is packed with long sessions. Maybe you're doing hour sessions, 90-minute sessions. Well, Diamond Active Massage is a different way to bring your massage skills, your expertise, your knowledge to your clientele that addresses all of the common complaints. So it's a really beautiful integration of adding what you already know, what you're already doing. You don't need to go and learn any new magic methods or approaches. When we take what you already know and we combine it under the direction of a Diamond Active massage, you'll find it's so much physically easier on your body because the client is doing most of the work. It sets you apart, so clients come searching for you because, again, this is a new concept. The word's going to get out and people are going to be asking for a damn good massage. It's going to position you so clients are happy to pay a higher fee, pay more than they may be paying for your services now. It virtually will eliminate any competition because this will be unique. And it could cut your schedule in half because you're able to deliver the same amount of relaxation of the muscles and the emotional tension, mental tension, and stress that you might require a longer session when the client is passive. So in this approach, you're able to actually shorten your sessions and the clients are still thrilled. So you found this new massage, Diamond Active Massage, so you can give the best damn massage in town. And yes, we will be making t-shirts. So who provides Diamond Active Massage? Is this the right approach for you? If you see yourself as someone who's unique and wants to stand out from the crowd even more, rather than providing the same old massage, then this is for you. This is for therapists who are already skilled. I mentioned that, already skilled. You already know how to give a terrific massage, but you're looking for something that's more comprehensive, longer lasting, provides faster muscle and stress, tension relief, and improves mobility. So rather than working harder and longer, having the client be actively involved, neuro-facilitated movements, which we'll talk about, is the secret. This is for therapists with a clientele who want to take responsibility for their health. And this is an important piece. You have to address clients who, or have to have clients who want to address their health and wellness and participate. Rather than just letting the client snooze on the table where the therapist does all the work, this is where you both are going to interact and co-create the results. This is for clinic owners ready to step up and take their rightful place as the go-to practice. So this is with dedicated therapists sharing the mission, the message, the movement, and the magic, possibly even the world, rather than blending in with all the other practices. So again, it's not for the average therapist. If you see yourself as somebody who's really standing out, and this is an important piece, and shamelessly states confidently that you want to charge higher fees because you know your services, skills, and the entire experience you provide are worth a whole lot more. Rather than charging low fees, trying to attract and keep clients, this might be the perfect solution for you. So let's get into the nitty-gritty of how a Diamond Active Massage works. Some of you are brand new therapists. Some of you have been in practice for a while. Some of you come from a spa background, a medical background. There's an understanding now that when clients are active versus passive, that's where we see the best results. So typical massage, the client's passive on the table. Typical massage, the client snoozing, thinking about going off to the Bahamas or their shopping list, or what happened at work that day. What we want to do is we want our clients in an active massage to be active. The best therapeutic outcomes occur when the clients are motivated and committed to the therapeutic process, in addition to when they involve engaging their muscles and moving their joints. So many of you in a passive massage, you do the work, you move their joints, you reposition them, you might pick up their legs to put the bolster under. That's passive. The client is passive. That's what I consider an outside-in approach. The client is receiving in a passive manner. With Diamond Active Massage, it's the flip of that. It's an inside-out approach. So they are actively engaged, actively communicating. There is conversation, and they are part of the results, part of creating the results, rather than waiting for you to do it to them or for them. So that's a really important piece to understand the difference. Typical massage, chiropractic, acupuncture, even manual therapy and physical therapy clinics is usually passive. Typical massage is received. It's wonderful. And if you want to provide deeper release of muscle contractions, deeper relaxation, when the client's active, you'll find it's like turbocharged. And that's why you can do a shorter session and still get the same outcome. One of the things that's really important is that we focus on an evidence-based understanding. So active movement is supported by our current understanding of how the muscles work, how the nervous system relaxes, and it's emphasized by involving the client. And then, of course, it adds to the therapeutic relationship. So it's called a therapeutic alliance when you have a good relationship with your clients. And I don't mean a relationship where they like you, which of course is wonderful, or you like them, but it's actually where you're both working collaboratively to relieve their complaints and achieve their goals. I always talk about, what do you help your clients relieve and what do you help them achieve? And so when you work together towards that goal, versus again, them passively thinking you're going to fix them or you're going to do the work, that's where the results happen much more comprehensively, efficiently, and effectively. So this is based on the clinical rehab method that I developed called active modulation therapy, the Diamond method, but Diamond Active Massage is designed for spas and massage practice environments. So it's perfect. Here's a picture of the rehab method where clients are wearing clothes and you're moving them around and you're not under the sheets and all. But in a Diamond Active Massage, it is structured for the spa environment. And so you would have them be undressed for the most part. And we'll talk about it in a minute, but using lotion and or oils. And again, the magic is in the inside out approach because it's neuro-facilitated and they're aware and they're communicating with you regarding what they're feeling, what they're sensing, how the pressure is, how their joints feel. They're giving you ongoing feedback. You're giving them ongoing direction. And it's literally a conversation while you're working together in the massage environment. So the client actively moves their joints and contracts their muscles under your guidance while receiving manual compression. So in this picture, again, these are taken from the rehab method, but you would be holding your hand on their quads as they extend their knee, and you can be doing a static hold, or you can be doing a glide, applying compression as they're engaging their muscles and moving their joint. So they're actively moving under your guidance. You're still controlling the session, you're directing them, and they're following your instructions. So it's not them just moving and you're trying to chase them and follow along. You're directing, you're guiding, you're the advisor, you're the director of the show here, and they're following your instructions to see to know how to move. Therapists have told me time and time and time again, and if you're using active Diamond massage right now in your practice, or something similar, then you know it provides fast, effective, efficient tension relief. So it's easy to learn, it's easy to apply, and it really is unique. And you'll see here, Vicki Nugent Howard, she had posted this on a Facebook video of the method, and she says she loves the active work. It's so much quicker release for the clients and less effort, and that's what's so important. We need to be able to prolong our careers, and this is a beautiful way to not only stand out and deliver easier client results, but your clients will love it, and it's less work for you. All right, so we are going to jump into part of the actual session. We have what we call the simple 6, and these are movements that we direct our clients to do while we are providing the manual pressure. So 2 of the 6 we call the windshield wiper, and that's the arm or the leg does the windshield wiper movement. So you can see, and if you see me in my thing, windshield wiper is basically, as it states, like a windshield wiper on your car. It's a movement where it's possibly with your arm, it would be external and internal rotation. It could be flexion, extension, as shown in the picture. And when you're applying the manual pressure, you're usually eliciting a cross fiber effect. But again, instead of your hands doing the cross fiber or your forearm doing the cross fiber, the client is moving, and the end result is the same, but it's active involvement here. It's client initiated. So that's still cross fiber, yet it's initiated by the client, and you're the tool. You're providing the pressure. So again, windshield wiper can be applied to the arms, the leg, or sorry, let me say the arms and the legs are doing the movement, the windshield wiper movement, but it can be applied to the shoulder, the hips, the pelvis, any areas that are related. And then we have the WAG, and the WAG is for a foot, hand, head, or pelvis. So in the picture here, you can see if we were holding, the client would be doing the WAG, and our fingers are holding, and it's a longitudinal stretch, a longitudinal impact as opposed to cross fiber, although we can easily do cross fiber with the WAG as well. So you're guiding your clients through these 6 simple movements. Again, we call them the simple 6 while you're applying your manual pressure. And it's really amazing. And yes, it takes a little guidance at the beginning. You do direct your clients with the simple 6. You explain it to them. If they've had it before, they already know. If they've come from another provider who does Diamond Active Massage, they'll already know the simple 6. If it's the first time they're receiving a Diamond Active Massage, then you explain it to them. So that way, once they're on the table, they get it, they know it. They don't have to think, or you don't have to stop and they have to look at you with their kinking their neck, trying to contort themselves to see what you're doing. So you give them that guidance in advance before they even have their very first session. And then on the table, face up, face down, sideways, however you're having them be positioned, they already know the direction. So when you say do the windshield wiper for your arm, they get it. The structure is usually 30 to 60 minutes, but again, like I said, you can shorten the time. Here's a picture of someone receiving a massage on the table in the prone position. Obviously, it's a photo that was a stock image because we would have them have a sheet underneath, but you can see that the glide goes down their arm, superior to distally, as he's doing his windshield wiper. So his arm would be internally rotated and then externally rotated back and forth as you're gliding down. Usually we use lotion or oil, whatever your practice uses, because you are getting that glide. So it's incorporating pin and stretch, like I said, longitudinal, cross fiber, static holds, whatever you'd like. And the cool thing is, again, you can usually double your fees. Now, here's the thing. There is a warning because it's not for clients who want to relax and not move. So I forgot the woman who mentioned how to integrate it. One of the things you're going to use in your conversation with your clients before you have them start moving is you literally have to say to them and ask permission, is it okay if we do diamond active massage where you're going to be moving? I will guide you and ask you to do some movements. Would you like to do that? Because if they're thinking they've had a really tough day and all they want to do is snooze on the table, this is not for them. You'll be getting pushback. So you need to make sure your clients want to participate. It's not for clients who want to be fixed by you. Because again, this is a co-created session. You're not doing anything to them. You're doing it with them. You're working together. It's not for clients who aren't ready for something different. People like what they know. They like familiarity. If you come in and you say, hey, I've got this new thing, if they're open to it, terrific, but be aware that some clients might not. Now, if you're calling it a different approach, so this is now diamond active massage, different from the other approaches, then they can decide which session they want to schedule. Certainly not for clients who want to sleep and not talk. And it's not for therapists who aren't comfortable talking during their session. You are going to be creating a different environment. This is not an environment where you're talking softly and you're limiting conversation. This is more corrective-based, therapeutic-based, where you're interacting, and you need to be able to have an open dialogue with the client. You need to have communication because you're going to be guiding them. And you're also asking for feedback and making sure that what you're doing is as impactful as possible. It's not for therapists who aren't ready for something different or new, just like the clients. It's not for therapists who are afraid to take control and guide clients' movement. So again, if you're shy and hesitant, this might be a little uncomfortable for you. You can certainly learn it, and I would love you to learn it. And I want to be honest and keep you and give you this warning in advance so you can make a choice whether this is an appropriate approach for you or not. So achieve or relieve, what kind of clinical outcome do you provide your clients? What do you help them achieve? Do you help them perform better, run faster, sleep easier, reduce swelling? What do you help them achieve? More productivity, clearer thought. What do you help them achieve? Or what do you help them relieve? Relieve pain, relieve swelling, relieve migraine, relieve stiffness, relieve limitations in their mobility. What are the outcomes that you strive for? And I believe, and it is a bold claim, that this aDAM massage is the best approach for clients who want a new, effective, efficient type of massage. A bold claim. It's not passive. Remember that. This is an inside out approach versus the outside in. Like I already mentioned, traditional therapies, massage, chiropractic, and acupuncture, the client's a passive recipient. In a diamond active massage, your client is an active participant. So today's presentation comes directly from the full Diamond Active Massage 12-hour course. And I hope that you found it helpful. And I believe I'm at the end of my presentation, and I'm happy to answer questions on how you can integrate this.
Well, thank you so much, Irene. And before, when you asked folks towards the beginning to submit chats, I think we missed two of them. From David, too many clients want same-day massage. So that was one of his issues that he's dealing with. And then again, when clients help or resist or lock limbs.
Okay, we can talk about that for sure. Yep.
And everyone still continue to feel free to chat questions or comments for Irene.
Yep. So the most important thing, again, if you're thinking about how to integrate Diamond Active Massage into your practice as it already is recognizing the biggest difference is the client is active. They're talking, they're moving, they're communicating. And that paradigm shift is super hard for some practitioners to come to terms with. Part of it is because of how we were taught that the room should be quiet, that it needs to be dark, that it's the client's chance to relax and de-stress. And that's fabulous. And there's another approach. So when your clients are looking for something different, something faster, I encourage you to suggest this. So David's comment about when the client helps or resists or locks limbs, again, in a Diamond Active Massage, if they're resisting, I would literally address that right then and there. And I'd say, Mr. Client, do you notice that when I'm pressing your shoulder down, you're giving me some resistance? I'd like you to take a breath and just relax that shoulder and let the muscles release and lengthen with your exhalation. You're communicating, you're bringing their awareness to the area. Oftentimes clients have no idea that they're contracted or that they're resisting. So when you notice that, again, it's co-creation. So you're bringing that awareness to the client who may have no clue. And I'm remembering a picture that I just took of a client I worked with, brand new client. She's laying on the table supine, and I do the diamond method, which is the rehab method. But she was laying on the table supine. She thought she was relaxed, and she wasn't. She thought her muscles were relaxed. Her legs were straight, and her knees were parallel, and her feet were, facing the ceiling. And I asked her a few times, are you sure that your legs and your hips are relaxed? She said, yep, absolutely. Now she came in with low back pain and sciatica complaints. So it stands to reason here. I'm observing that her legs were internally rotated. She was not even aware of it. She thought she was relaxed. And when I directed her through how to release it, which literally took 2 seconds, 3 seconds, and then I took another picture and she's, nice and relaxed with a slight external rotation. And she had no idea, but her femurs were internally rotated. So it wasn't her knees, it wasn't her feet, but that's what I was seeing because it was coming from her hips. So by guiding your clients to be aware of how they're presenting, what's going on with their bodies, without diagnosing, of course, but you can assess, you can evaluate, and then helping them guide them through it while they're moving, you're going to start seeing really tremendous results. Any other questions, Donnell, come up, or if anybody has
I haven't seen any come up, but
okay.
I would ask the question, you're based in traditional massage and you learn the Diamond Active method. Do you ask the client when they come in? Are you here for a relaxing massage? Are you here to
Yes,
work
I
on?
gotcha.
Yeah.
So this gets back to all my business coaching, and I'll throw this in now because it's really important. There's the understanding that practice should be client-centered. I have a little twist on that. Yes, client-centered. So Donnell, you're coming to me today because you've got a kink in your neck that has been bugging you for 2 weeks because you slept funny on your sister's couch. I would like to suggest a Diamond Active Massage for you rather than the traditional Swedish massage we've been doing for the last 3 years. How does that sound? I think it's going to be way more impactful, faster, to help you get rid of that kink in your neck. So I find out what's going on with you, but I don't ask you what you want because the client may not be a provider. They might not know what they /need and want. They just know, I've got this kink in my neck. I want to get rid of it. What do I do? And they come to us for our advice. And that's why I'm a big believer that providers should be advisors, not order takers. Providers, not order takers. Plug for my book. There's a whole section on that. What's the role you play? Now, if you're working for somebody else, if you're in an environment where you're an employee, it's a fine line because you need to follow the protocols and the expectations of the practice you're working for. If you work for yourself, this is where I would advise you, and the people who do the best with this type of approach are providers who feel confident in their ability to guide and advise their clients. Again, what are you trying to help them achieve? What are you trying to help them relieve? What's the fastest way to get there? And that sometimes means referring out to another healthcare provider or another, go for a walk on the beach, versus scheduling a session with me. So that's where you become the fiduciary for your clients, looking out for their best interest. So yes, I believe that client-centered practices are important, asking what the client wants, understanding what the client's goals are, and then you, as a provider, guide them and say, this is what I think would be best for you to achieve that end result.
Now, is there a hybrid approach using the traditional along with the Diamond Active method?
You certainly everything can be integrated into a different experience for the clients. However, again, it's important because one is passive, one is active. It's important to get the agreement from your client that they're willing and able to be active on the table.
Very good. Well, everyone, we still have a few more minutes for Irene to answer questions or take your comments regarding incorporating this into your practice, or if you want to go back and to where Irene began with some of the challenges that you face in your practice, possibly things you'd like to change. We still have a few minutes, so I'd love to hear from you.
Yep, and I've taught this before on a small scale, but this year I'm really excited to bring it out on a bigger scale. And right now, if anybody does want to bring me in, either virtually or in person, I am offering special bonuses for the people who sign up now to enroll this year, because again, it is something that is going to go out on a bigger level. And I'm really excited because the results are so extraordinary that I don't want to keep it too small. I want more therapists to understand and learn it. I want more clients to be able to receive it. And if you have a practice in your city and your clients experience Diamond Active Massage and then they move to another location and there's a provider there and they understand the concepts, just imagine how profound those changes will be, because they're already well versed in the Simple Six. They know what to expect. They're ready to go. So all the hard work of selling or anything like that is gone, because they come to us knowing what to expect and what they're going to receive. It's really pretty remarkable.
It is, especially when you know you're going to walk out with relief and results.
Yep.
I'd like to mention to everyone that tomorrow you will receive a follow-up email. The email will have a link to the recording. It will have a copy of Irene's PowerPoint with a corrected word spelling. And also it will have Irene's contact information so that you can learn more from her about opportunities to learn more about a damn great massage. So, in closing, I'd also like to mention, please join us. And thank you for putting your email in the chats, Irene. I'd like to invite you to join us. And for those of you who don't know that we also have an EduTalk Diabetes series, many of you have clients with diabetes or family and friends with diabetes, and this is an excellent way to expand your knowledge as well. On February 13th, next Tuesday, we have Wendy White, and she'll be presenting on massage considerations for diabetes clients and patients. And on February 20th, we have the Massage Edu Talk with Dorothea Atkins, and she's presented Edu Talks as well, and which can be found in the archive library. Dorothea will present a proven new approach for osteoarthritis joint pain, self-massage. So she is a very engaging speaker as well. Please visit the EduTalk Archive Library to find Irene's other talks. It's on biotone.com under the EduTalk tab. You can also RSVP for upcoming EduTalks there. And Biotone's website, ease-z.com, will take you over to the diabetes dry skin lotion, therapeutic lotion, and foot cream, where you can also visit the archive library and listen to talks on diabetic concerns, and also RSVP for Wendy's massage considerations for diabetes clients and patients. Keep an eye on your inbox. If you don't see it by the end of the day tomorrow, please check your junk mail or send me a quick email and we'll get this information off to you. Thank you everyone for joining us. Again, watch your inbox and join us for upcoming Edu Talks. Thank you, Irene. Your information is always so valuable and we appreciate you presenting. Thank you.
Happy to be here. Anybody has any questions, reach out to me. My email, Irene@diamondwellness.com. And there's lots of resources and citations I'd be happy to provide if you have any questions.
Okay, and your contact information again will be with the recording link and contact information in the email tomorrow. All right. Yep. It was great to see you. Some of you have had your video on, so I'm getting quick glimpses. Join us again. Thank you so much, everyone. Be safe and take care. Thank you.